Good morning, friends. On World Hepatitis Day, I'm going to talk about hepatitis. So, hepatitis can be of various types, but most commonly happening hepatitis is viral hepatitis. Viral hepatitis can be broadly divided into two types. One is acute viral hepatitis, one is chronic viral hepatitis. Acute viral hepatitis is caused by hepatitis A, B, D, and E, whereas the chronic viral hepatitis can be caused by hepatitis B and C. Today I will be covering about acute viral hepatitis. So acute viral hepatitis happens most commonly in this type of season, which is rainy season, monsoon. And most commonly happening is A and E in our country. Most of the kids at some stage in our life, they contact viral hepatitis A and E. Hepatitis is nothing. It is basically the inflammation or swelling of the liver, and it can be caused by the various types of the virus. And these virus spreads through what we call is fecal-oral route. So it is spreads through dirty water or contaminated water, or it can be spreads through contaminated food. So if we drink the contaminated water and food, it can spread from one person to other person. Most commonly happening symptoms in these type of hepatitis is patient will develop fever, prodrome symptoms. They will develop jaundice or yellowish eye in your nails, so which is high bilirubin. Patient can develop rise in liver enzymes, which is SGOT and SGPT. Now, these type of viral hepatitis, mostly they will get cured on its own. You don't need to take any antibiotics or any medication to treat this hepatitis. I would say 95 to 97% of viral hepatitis, acute viral hepatitis, they get cured without taking treatment. Patient just needs symptomatic treatment, which means they need to take a paracetamol for bring down the fever. They need good nutrition to support the liver. But very rarely, which happens in 1 to 2% of the patient, these hepatitis leads to acute liver failure. The acute liver failure is a dangerous condition which can happen from the viral hepatitis. In acute liver failure, the bilirubin goes very high, the liver starts to fail, the liver protein liver starts to stop making protein, so INR level will go up high. Patient can develop encephalopathy and various other symptoms. Now, this is a serious condition which needs to be treated only at a dedicated liver unit. Besides these, as I already told, most of the hepatitis, acute viral hepatitis, they get treated on its own. They have their own spectrum, own natural course, and slowly your bilirubin will go up, and then it starts to come down. The fever will go away, and patient will recover. Now, important thing to learn or understand today is these type of hepatitis are preventable. They are very easily preventable. We have good vaccines for viral hepatitis A and B, which needs to be taken at infant stage. So, hepatitis B vaccine is included in our vaccination program by Government of India. So, all kids should be vaccinated for hepatitis B. And similarly, hepatitis A, there is a very good vaccine available, and patients should be vaccinated for hepatitis A. Now, even if we are not vaccinated for these types of hepatitis, just simple measures like cleaning your hands, not eating or drinking roadside food. The water should be boiled, especially in this rainy seasons when there is a lot of other infection going on. So these simple measures can help us in preventing this hepatitis. So again, I would just like to end here and concise viral hepatitis, although looks like a simple disease, but in some patients it can be really dangerous. So, and these are very easily preventable diseases. You just need to have good vaccination, need to have good food,